You're watching Iowa Live. Everything local, entertaining, and meaningful in Central Iowa is right here on Iowa Live.
From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and it is time to visit with a very popular guest that we've had on the program. Dr. Naveen Gupta is joining us from ANP Foot and Ankle Clinic. Great to see you, sir.
Thank you.
Now, what we're going to do is we're going to review some of the past visits we've had with Dr. Gupta. First, let's talk about ANP Foot and Ankle Clinic.
Yeah, we're in West Des Moines, and we've been in practice for about 35 years now. And wound care is our main focus for past several years now.
Okay, so what we're going to do is we are going to talk a little bit about chronic wounds and why they don't heal, and more importantly, what they can do about it here. So chronic wounds, why don't they heal?
Chronic wounds, first of all, the wound that hasn't healed or is not healing or improving in 3 months or so. And most of the times, part of the problem is either you have too much swelling, you have some infection going on, or your diet is not under control. Okay. So we need to focus on those things, control the swelling, take care of the edema, and take care of the wound on a routine basis. It's not like you come in once a week and you're done until next week, because that 1 day to the 7 days, that's when things go bad.
They could get better for a day or so, then start in reverse. But
exactly.
How often? What's common for someone to see you during a week?
It depends on everybody's situation. Sometimes I'll see a person 4 times a week.
Really, that often?
Yeah, and then we go to every other day or 3 days or twice a week, depending on how the improvement is going and how the wound is actually doing.
But that is key, is that you are on top of that wound. You are watching it day to day or every other day if need be,
exactly,
to make sure it's going in the right direction.
That's right. So we take the ownership of that wound, and we're going to manage it until it's healed.
I love that phrase. So ANP Foot and Ankle Clinic takes ownership of your wound until it heals.
Until it heals, correct.
Okay. Now, in case you're wondering, you say, oh, you're just dealing with this. Tell everybody the consequences of neglecting treating a wound like this.
Anytime you have a cut or in the skin, it is going to have a possibility of getting infected. Once it gets an infection, things start to go downhill. If it's not treated, it goes downhill faster. The ultimate result is an amputation.
Okay.
Are you going to have an wound on the toe, or are you going to have amputation of the toe? No. The amputation is going to be at the level where you have good circulation. So if your good circulation is not up to mid-calf, that's where you're having...
Oh my God, really? So if it's your toe that's giving you a problem, you might have to take it at the mid-calf.
At the mid-calf or higher.
Really?
So once people have amputation, this is statistically up to 40% of people will die in first year.
Let's say that again, because this is pretty powerful.
The mortality rate for people that have amputations is up to 40% in first year. And
wow,
up to 80% in 5 years.
Wow. So you don't want an amputation.
You don't want to go down that road.
Wow.
So the sooner you have a cut or a wound in your leg or foot, anywhere for that matter, seek help.
That is amazing. And you can treat these things, and you have incredible results, don't you?
We have been doing very well so far. I've had several people come in that were scheduled for an amputation that we were able to walk back and heal them right.
Oh, and the type of methodology you use, the type of things that you do are what?
There are several different technologies. We'll use a non-contact ultrasound mist therapy. We'll use cellular tissue products that are like graft materials from porcine or human placental tissues or fish skin tissues, and standard wound care.
Okay, but this is continuous, personalized care, unlike you're going to get anywhere else. And so you mentioned that your practice is over in West Des Moines. If people want to get a hold of you and get some more information about this and make an appointment, what can they do?
Well, they can go to feetdr.com, www.feet, feetdr.com, or call the office 515-226-2189.
Okay. Again, if you have a chronic wound, you have a wound that just won't heal below the knee, ANP Foot and Ankle Clinic is the answer for you. And Dr. Naveen Gupta will be there, hands-on.
Hands-on.
Right? Hands-on.
I do not delegate my care to somebody else.
That is awesome. Dr. Gupta, thank you so much, sir.
Thank you.
When we come back, we're going to find out all about the Marion County Fair going on this week, including Knoxville Raceway stuff with Kyle Larson. Right, Kyle? Is Mike going to be here? All right, that's next on Iowa Live.